right. Can you all hear me? Can you hear?
Yes, I can hear
Okay,
you.
all right, perfect. All right, so thank you for having me here today. My name is William. I'm the Director of Pharmacy at Delray Medical Center. And I'll talk to everybody a little bit today about medication safety and things that we can do every day to try to make sure that we're using our meds correctly and in a safe manner. So what we're going to talk about is significant medication misuse, contributing factors to medication misuse, advertising, patient behavior, populations at risk, importance of reading labels, brand name extension, which we'll talk about, health literacy, proper storage and disposal, and of course, working with pharmacists to make sure you're taking your meds appropriately and safely. So unintentional medication misuse can lead to patient harm and additional healthcare costs. So obviously we do not, want these things to happen, but unfortunately they do occur. So here's the leading causes of misuse of medications and medicines. So people take a lot of legal drugs, right? There's a lot of medications out there to treat a lot of different diseases. A lot of people have more than one issue that needs to be dealt with a medication. So, the more factors we have, the more chances we are that something could possibly go wrong or we'd have a drug interaction, et cetera. So there's lots of prescriptions written. There's lots of over-the-counter medications. There's lots of natural medications, and there's lots of vitamins available. If we were to walk across the street to the pharmacy, we'd be overwhelmed with the amount of products that they have, right? So TV ads, direct-to-consumer advertising for over-the-counter as well as prescription medications. Over-the-counter labels are really hard to read. So I'll show you some examples of that as we get through the presentation and how to read them correctly and consistently to avoid any mistakes. Seniors and parents get confused, and then written information is extremely hard to read. So it's kind of an old report, but it's the most recent report we actually have from the Institute of Medicine about basically preventing medication errors. So 4 out of 5 US adults take prescription over-the-counter dietary supplements every week. 33% take 5 or more medications every week. So 1.5 million injured by medication errors. That was in 2006. And medication errors cost about 3.5 billion in 2006. So that's lab tests or hospital visits or hospital admissions, et cetera. Scope of the problem. So 2 out of 3 patients leave the doctor's office with a prescription. 3.4 billion prescriptions were filled in 2005, and 40% of the US population received 4 or more prescriptions every year. So, there's just a lot more medications now to treat a lot more disease states than there were, even 5 years ago, 10 years ago, 20 years ago, which is actually a good thing because it's prolonged, life and made disease states a lot more tolerable for people. So they can, live through them. But at the same time, it can lead to medication misuse or medication errors if we're not, being safe and using things appropriately and correctly. One of the major things that has, kind of surfaced in recent years is the pressure to receive prescriptions, especially with the antibiotics when people visit doctor's offices. So there's 23 million antibiotic prescriptions were written for things like colds, bronchitis, and upper respiratory infections. So unfortunately, the majority of these things are caused by viruses, which I'm sure most of you know, antibiotics don't work against viruses. So it's just kind of like people feel when they go to the doctor, they're not feeling well, they check them out. They feel like if they don't leave without some sort of medicine to help them, that they got ripped off or the doctor didn't listen to what they were saying and didn't treat what was wrong with them. But in most of these cases, you would have got better on your own because it's a viral infection and not bacterial. And the antibiotics really didn't do anything. So, 44% of children were given antibiotics for colds. 51% of adults were given antibiotics for colds. And then the CDC estimates that 70% of bacteria causing infections are resistant to at least one common drug. And I can tell you that is true. There's a lot of antibiotic resistance in the communities, and a lot of it is due to this overprescribing antibiotics. So a few years ago, we had a major push, hospital level, national level, something called antimicrobial stewardship or antibiotic stewardship. I'm not sure if any of you have heard this terminology before, but it's really looking at how we use antibiotics and trying to limit their use. So one of the main things that we try to go after was the overprescribing of antibiotics and making sure that all antibiotic use was warranted and was acceptable and appropriate. So another thing that can be problematic is alternative medicine. So the scary thing about these to me is that people don't think of these things as medications. They think of them as natural, just remedies. But there's a lot of natural things out there that could kill us. I mean, tigers are natural. If we go out in the jungle and we run into a tiger, chances are it's going to kill us, right? There's a lot of plants that are poisonous. If we were to eat them, they would kill us. So these are no different than medications in the fact that if we don't use them correctly, or we don't use them appropriately, or we don't check to make sure that it's safe to take these things with our prescription blood thinners or whatever, we could have adverse outcomes occur. So you got to think of these as medications. So when you go to the doctor's office and they ask you what medications are you on, or if you go to the pharmacy and they ask you what medications you're taking, you have to think of these as medication, and you should put these on your medication list. So it's 44.6 million people use herbal remedies, and 24.2 million people use specialty supplements. So again, these have a lot of drug interactions and can cause a lot of problems. So you need to communicate these with your healthcare providers to let them know what you are taking. Okay. So like I said, natural doesn't equal safe. So I remember a study about St. Johnswort that came out in the 1990s when that supplement was really popular for depression. What these people did is they looked at all the different companies that made St. Johnswort, and they chemically analyzed the dosage forms, capsules, tablets, whatever it was, to see how much of the active ingredient, which would be St. Johnswort, was actually in the dosage forms. So when they did this, they found, I remember reading this article, they found a huge discrepancies amongst the products. So some of them had about what was labeled on the package, some had nothing, some had 10 times what it was labeled. And then the scariest part of that to me, of this whole thing to me, was that they found traces of things that weren't supposed to be in there. The one that got me the most is Digitalis, which is the Dioxin, which is, if anybody knows what that is, it's a medication used to treat heart conditions. It can be extremely toxic if not taken correctly or appropriately. They're finding traces of all these things in the herbal supplements, and it really, made me think about them. And I personally never recommend them to use because, they can't guarantee what's inside of them. So the reason that's the case is because they're not considered, medications or drugs per the FDA. So they don't have to go through any FDA approvals. They don't have to, have good manufacturing practices. They don't have to have really good quality control measures in the factories that make them. So, again, just err on the side of caution if you are going to use these things. Like I said, I personally don't recommend natural remedies just for that fact alone. But if you are going to do it, everyone's free to make their own decisions. Just make sure you're trying to use, brand that you feel is reputable and that you think would have good quality, because there's a lot of stuff out there. So this is just on here just for a visual effect. It's just, so this is one of the references that we have inside the hospital here that kind of looks at herbal remedies and their drug interactions. So as you can see, there's only several on here as far as herbal remedies, but you can see there's a lot of drug interactions, and they can play, major roles in causing adverse things to happen to people who, take them and don't necessarily know that they have interactions. So if you're going to take something that's herbal or, natural, make sure you're checking with, the pharmacist. They should have references like this in any of the retail pharmacies where they can look and see if there's any known interactions between medications you take and Herbal Remedies. One of the things that drives me crazy as a pharmacist is direct-to-consumer advertising. So, direct-to-consumer advertising of prescription medications. Obviously, the drug companies know that this works, otherwise they wouldn't be doing it. But this Consumers Report survey came out and it said about 78% of the primary care physicians that they asked were asked by their patients for specific drugs advertised on TV. So it kind of changes the whole dynamic of practicing medicine for them. So, when I was young, or I'm sure when most of you were younger, we went to the doctor and we got checked out. We weren't feeling well, and they would prescribe us something to make us feel better. But it's kind of flipped it, where people are now going into the doctor's office and saying, hey, I saw this commercial on TV. My stomach's kind of hurting. I think I need that purple pill I saw on TV last night. And I think the doctors would just say, oh, get out of here. You don't know what you're talking about. But they're under a lot of pressure to keep their patients happy and to, have their patients feel like, they're being valued and that they're taking good care of them. So, they feel a lot of pressure to prescribe meds, and they do. So in this survey, as you can see, 67% of the doctors that were asked actually granted the patient's request. So, obviously I don't know the details of what those requests were, what medications they were, but, still it's put a lot of pressure on them to keep patients happy and to meet the requests. And, the drug companies know this. So, they know that people are going to go in and ask their doctors. So, of course, they keep advertising to the general public. So here's a little graph that just kind of explains how prescription and over-the-counter drugs are similar and different. So prescriptions, they're ordered by a physician or a nurse practitioner or some sort of healthcare provider, right? You can't just go into a pharmacy and say, I need that prescription that's back there, whatever it is, from the pharmacist, and they'll hand it to you. They won't. You need a prescription. I mean, that's kind of common sense. Everyone knows that. You have to bring it to the pharmacy. They'll fill it for you. And the thing to keep in mind is prescription drugs are only intended to be used by the person that they were prescribed for. So, we're not supposed to share them with our friends, with our spouses, with our whoever. They're prescribed for one person to use for one specific condition. Over the counter, we can buy them, right? We can go to Walgreens, CVS, wherever. We can walk in there. We can buy them without a physician's order. We can go down the aisles and kind of just browse and buy whatever we want. These are intended for use for multiple people. So, if we have a bottle of Tylenol in the cabinet and I have a headache, I can take it. My wife has a headache, she can take it, etc. So that's kind of the differences. So similarities, you have to follow the directions and read them carefully and follow them correctly. So, this is to prevent overdosing, to prevent underdosing, just to make sure we're taking medications correctly. Of course, children should only use whether it's prescription or over the counter, with the permission of a parent or guardian and under supervision of them. We don't want kids going into the cabinets, taking out the bottle of Tylenol and just taking whatever they want. It could lead to some really bad things happening. Then, of course, pharmacists, we can answer questions about either of them. So here's some use issues, some factors that impact appropriate medication use and outcomes. So here's some common causes of medication misuse. So taking incorrect doses, right? Taking doses at the wrong times, forgetting to take doses, or stopping medications too soon. So, some things that we can do to prevent these things from happening are to read the bottle, make sure we're taking them exactly as it's written on the bottles. Times, making sure we're taking them at the times they're prescribed. Like if it's prescribed to take in the morning, we're taking it in the morning. If it's at night, we're taking it at night. If we take doses, so usually if you forget to take a dose and it's a daily medicine and you realize it, a couple hours later, in that scenario, it's okay to just go ahead and take that dose. But if it's something you take 2-3 times a day and you forget a dose, it's probably best to skip a dose and go to the next dose, and then pick it up from there. What to do if you stop a medication too soon. So we see this a lot with antibiotics, and it's probably one of the worst things you can do. Antibiotics in general, after 2-3 days of taking an antibiotic for an infection, you will start to feel better, if not feel completely better. And what happens is people think, oh, I feel better, I don't need to take it anymore. You know, doctors prescribed it for 10 days, but after 4 days, I'm feeling better. I'm just going to stop taking it and then save it for next time when I get sick, right? That's actually a horrible thing to do, because what you've now done, you feel better, but that infection is still probably brewing in there. It's just that your body's winning and your immune system's taking over and starting to fight it back. So you feel better. But you stop taking the antibiotic, chances are it's going to come back, which is bad in itself. But to make matters worse, it's probably going to be resistant to whatever antibiotic you were just taking, which leads to a greater issue when it comes to antibiotic resistance and antibacterial resistance. So you may need something stronger, something that's going to, you know, maybe have more side effects. So again, it's important to finish the full course of antibiotic therapy. Here's some common things that can happen. So if you're missing glaucoma medicines, you know, you don't want to do that too often, because if you do miss them too often, it could lead to further damage with your optic nerve and potentially even blindness. So, you know, it's important to remember to take those medications as they're prescribed. One thing, you know, blood pressure meds is another one. You know, blood pressure is tough because you don't necessarily feel blood pressure. It's something that you measure. But what happens is you don't want to just stop taking blood pressure medications unless you're under, you know, close supervision of your provider, because what happens usually is, like, when you stop taking them, your blood pressure will rebound up higher than it would normally be. They call it, like, you know, rebound, you know, hypertension, which could lead to, you know, heart attacks and strokes and things like that. So a lot of times with these meds, it's better to kind of like taper off of them or to wean down on them slowly. So, you know, we just don't want to stop taking them without, you know, being under the supervision of our prescribers. Of course, seniors are at risk. Elderly is 13% of the U.S. population. The elderly account for about a third of all prescriptions that were dispensed. And then the average number of prescriptions for an elderly person was about 29 in 2000. It actually did reach 38.5 in 2010. It's higher than that now. But about 240,000 people were hospitalized every year from drug interactions between prescription and over-the-counter meds. So again, over-the-counter meds have to be on your med list too. So I'm hoping everybody here does have a medication list, because that's probably one of the most important things that you can do, especially if, you know, you get in a car accident or something happens to you and you have to come into the hospital. We need to know what medications you're on, because that could play a huge factor in how we treat you. It could, you know, potentially be one of the things that makes you even worse than what you are now, especially if you're on a blood thinner and, you know, you get in a car accident, you're bleeding. Like, we need to know that, because we need to be able to stop you from bleeding. So make sure that your drug, you know, lists are updated. You have your allergy information on there. You have all the prescription medications you take on there. You have all the over-the-counter medications you take on there, and you have all the herbal supplements you take on there, okay? And keep it up to date. Barriers. So here's another thing that puts seniors at risk. You know, as we get older, our vision's not as good, our hearing's not as good, and, you know, our cognitive impairments. So, you know, opening pill bottles or opening things like that, you got to make sure that you're able to access them. So slower organ function. We spend a lot of our time here every day in the hospital at Delray Medical Center, functioning in this role, making sure that, you know, we have doses that are correct for people's kidney functions, that they're good for their liver functions, et cetera. That's one of the major things we do here every single day. Labeling and packing are difficult to read, difficult to use, and lack of health insurance and drug costs. So, you know, these are all things that do put seniors at risk for having adverse outcomes with, you know, medications. Elderly overuse. So here's an example. So unnecessary use of antihistamines, anti-anxiety, sleep aids, and minor tranquilizers. So, you know, the combination of these things leads to lots of falls, fractures, and car accidents. So in 2005, the combination of, you know, mixing these medications together led to about $27.3 billion in healthcare costs. Over-the-counter meds. So here's a quick little did you know and did you know. So did you know that Tylenol and NyQuil contain the same active pain relief medicine? Did you know the popular prescription medications Percocet and Vicodin also contain acetaminophen. So a lot of people don't know these things, and it can lead to overdosing on Tylenol, which is why I'm going to show you on these next slides coming up how to look to see what the active ingredients are in a lot of these formulations, because it's super confusing. So this is another one of the things that drives me crazy as a pharmacist is the brand name extension of products. So Tylenol. So Tylenol has at least 50 different products in the prescription aisle. So it's extra strength, there's Tylenol PM, arthritis, cough and cold, cold and flu, sinus, allergy. I mean, we could keep going on and on and on. So you would think that, you know, they're all the same, and they kind of are, but they're also major differences. So this can lead to overdoses or taking wrong medications that you weren't intending to take. So it's important to actually look at the back of the packaging, which I'll show you here coming up. So here's an example kind of what I'm talking about. So we got two products here called Dulcolax. So, you know, if you look at them quickly, you could think that they're the same thing because their branded product name is the same, Dulcolax, Dulcolax. But when you actually look at the smaller writing under there, one's a laxative and one's a stool softener. So there's a big difference between a laxative and a stool softener, right? Which could lead to, you know, some unintended GI upset later on in the evening if, you know, we were meant to take the one on the right and we took the one on the left. So what we need to do is focus again on packaging, which I'll show you after this slide. So here's another good example. This is a Malox and a Malox. So, you know, Malox is a pretty common thing that people take. If they eat too much or if they ate something that didn't agree with them, their stomach's upset, grab some Malox and take some Malox. If you look at these two products, they look identical from the front. They both say liquid Malox, liquid Malox. They even have like the little mint leaves on the bottom that looks the same. You know, the little red banner up there on the top, it looks the same. But when you get into like the nitty gritty of it, this is what we need to focus on. So instead of focusing on the front of the packages we see here, when you are going to the prescription aisle or the over-the-counter aisle to look for some over-the-counter meds, this is what I want you to focus on. It's the back of the packaging or a different part of the packaging where you see a layout that looks like this that says drug facts. So if you look at this drug facts, this is the back of those two bottles that we just had from Malox, right? So the one on the left here, the active ingredients are aluminum hydroxide, magnesium hydroxide, and simethicone. So those are the classic ingredients for Malox. So that's going to be anti-gas, anti kind of nausea, vomiting, just to make our stomachs feel better. If you look at the one on the right, the active ingredient there is bismuth subsalicylate. So bismuth subsalicylate, you may not necessarily know what that is, but more people know that as Pepto-Bismol, right? The pink stuff. So you wouldn't necessarily know that looking at the packaging. But when you look at the back, you can see that they're different. So, you know, bismuth subsalicylate causes, you know, black stool. Black stool is also a side effect or a common thing that happens to people who have, you know, GI bleeds or gastrointestinal bleeds. So, you know, you could really intend to take Malox, take some Pepto-Bismol, then next day your stool's, you know, black and you're wondering what the heck's going on because I took Malox. You know, it's an unanticipated side effect, but if you take Pepto-Bismol, you would be expecting that. So it could make you, you know, say, oh my gosh, I gotta go to the ER, I'm having a GI bleed, when in fact, no, I just took Pepto-Bismol. So again, this is kind of like not a really serious, you know, thing, but still it could happen. Here's another one that drives me crazy. We got Kale Pectin and Kale Pectin. So Kale Pectin is, you know, traditionally taken because you have an upset stomach, maybe some diarrhea, right? So if you take the one on the right says Kale Pectin stool softener, the one on the left says anti-diarrhea. So why they have two things that do opposite things, I don't know. But that's why you need to focus on the back. If you look at the back, one of them would be the bismuth subsalicylate and the other one is docusate sodium. So again, focus on this part of the products when you're in the prescription aisle and not the front packaging to make sure you're getting something that you think, you know, you're intending to buy. All right, so safe medication use. So some common drug interactions we have listed here. This is why it's always important to keep that med list updated, like I was explaining to you, with prescription, over-the-counter drugs, and herbal supplements. So Advil and Motrin, they actually can be have some antiplatelet properties or anticoagulation properties. So, if you're taking them with alcohol or you're taking them with other blood thinners, you could have bleeding problems. Blood pressure meds. Here's one that's actually interaction that kind of cancels each other out. So, like the common ACE inhibitors we have here, like Zestro, Vasotec, Acupryl, they actually increase your potassium level. And then you have drugs like Lasix or even digoxin, they decrease your potassium level. So they kind of work against each other. Some other thing, antidepressants, there's lots of drug interactions with them. So, you got to make sure that you're letting everybody know you take those if you do take those. Antibiotics, and aluminum-based antacids, etc. Again, it's just more to prove the point that we need to keep our medication list updated with all the over-the-counter prescription and herbal supplements, okay? Vitamins too, of course. So prescription pickup. So, I'm a pharmacist, so I kind of know what goes on, but this is what I tell people to do, all my friends and family, whenever they're, picking up prescriptions at their local pharmacy. So the first thing you want to do is make sure that it is your medicine that you're picking up, right? It sounds stupid, but there's a lot of people that have the same name, and this can occur and can happen. So that's why they always ask you for like your address or your date of birth or some other identifier, because they want to make sure that, the John Smith that's picking it up is the John Smith, that lives at, 26 Main Street. So make sure it's your medication. Give your address. Make sure it matches whatever's on the prescription that they hand over to you when you're leaving the store. What I tell people to do is to open the bag before they leave the store. Look at whatever is inside that bag. Make sure the label is the same, medication that's on the outside of the bag. And then actually look at whatever is inside that bottle to make sure that the pill that's in there kind of looks familiar to you, and that, it's something that you're familiar taking. So if you're used to taking, the round blue pill, and then you open up that bottle and there's a square pink pill in there, not saying that that's not correct, because it possibly could be correct, because there's a million different manufacturers of medications now. But you're the expert on what you take and what it looks like. So it doesn't hurt to ask the question and say, hey, the last time I picked this up, it was a round blue pill. Now I got a pink square pill in here. Is this the same medication? I'm pretty confident the answer is going to be yes, but it's that one time when they get busy or they get distracted and they put the wrong med in there. You want to just double check and make sure that you're actually getting what you're intending to get. Okay. At home, so I tell people, keep the meds in the original container. So the prescription bottles, you picked them up in. Now, I also tell people that they need to use pill boxes if they forget taking their meds. So, kind of talking out of both sides of my mouth here, right? But what I do tell them to do is that they are going to use pill boxes because they forget taking meds, or just makes it easier. Like, don't set them up for more than maybe a week at a time, because, especially if you take a lot of different medications, because if we go to doctor visits or here and there, we're going to see, to get checkups and check out, my arthritis, check out my blood pressure. A lot of times the medications can change based on how you're doing and how you're responding to meds. They change doses and frequencies, et cetera. So, if you already have a month's worth of pill boxes set up and built out, and then you have a change in your medications, it's a lot harder to go through all those pill boxes and redo a month's worth of, layout than it is like a week. Plus, you don't want to accidentally add something in there and forget to take something out, and you're doubling meds, or, if the physician or prescriber told you to stop taking a med and then you forgot to take them out of the pill boxes, then you end up still taking them. So it just leads to a lot of potential problems. That's why I just tell people, if they're going to use pill boxes, to only set them up for maybe a week at a time, okay? If you keep them in the bottle, which is what I do, I always make sure I read the label every time I take it to make sure, I'm taking the right thing and I didn't, misread a label and think I grabbed something that I didn't grab. I mean, it happens all the time. Go to the refrigerator and try to, grab the mustard. And next thing you know, oh man, I grabbed the ketchup on accident. I mean, that's an easy mistake. That's easy to fix. But if we're talking medications, it could be a big problem. We want to make sure our eyes are not playing tricks on us and our brains. So read the label every time you take a dose. Like I said a million times in this presentation, make sure your medication lists are up to date. Make sure the allergy information's on there. food, herbal and drugs, because a lot of drugs are actually made from foods or from plants. So we need to know those allergies as well. And then place your medications in a safe location. So it's got to be somewhere that's out of the way from children, somewhere that doesn't have a lot of moisture, somewhere that's dry, and somewhere that's, room temperature to avoid, medications, going bad or not being of good quality. So disposal, depends on who you ask on this, what you're supposed to do. So the DEA wants everything to be flushed down the toilet, but the EPA says that they don't want anything flushed down the toilet. So what do we do? So fortunately in Palm Beach County, there's a lot of places that do take backs. I know the sheriff's office do it. A lot of the pharmacies do it. So what you really want to do is take whatever you don't need anymore back to one of these places and dispose of them that way. So the EPA has done a lot of studies on, runoff water, and they've found traces of a lot of medications that are coming out of treatment plants, et cetera, because people dump a lot of this stuff down the toilet. So, we don't want to be, have all that environmental exposure. So I guess I kind of do side with the EPA when it comes to this versus the DEA. And I would say, take them to a place that can dispose of them in the proper way, which would be one of the take back places, either a pharmacy or the sheriff's office in Palm Beach County. And again, if you can't do that for some reason, you can't get out, what you want to do is take them, put them in some coffee grounds or something and put them in another bag and then, put them out with your garbage. We actually see a lot of nowadays is that people go rummaging through, people's houses or people's garbage, and they're looking for prescription medications that are controlled substances, because we have a huge opioid epidemic in the United States, and it's unfortunate, but these things do happen. So again, this just goes back to more disposal, which I talked about, and the best thing to do is to take them to a take back pharmacy or the sheriff's office. And then these slides here are just really about using your pharmacist as a resource, which, I'll kind of summarize instead of going into a lot of detail with them. I mean, we're medication experts. So, if you do have questions about medications, never hesitate to come to us, even if it seems like we're really busy. I mean, that's what we went to school for, and why we became pharmacists is because we wanted to help people. And we want to make a difference in our communities. So don't hesitate to use this as a resource. Ask questions. If you have any questions about this lecture, you can feel free to ask them at the end, which we're getting to now. Or if something comes up later, you could have them reach out to Lisa, and I'd be more than happy to see if I can answer them for you. So it's kind of the end of the lecture here. Some references that I used, but if anybody has any questions, I guess now you feel free to ask.
And everybody, you're muted, by the way, so if you do have any questions, you'll need to unmute yourself, or you can always type them in the chat box as well.
Is there a pharmacy take back place close by Glen Eagles?
So I know the sheriff's office substations have these set up. So they're kind of like mailboxes. Well, actually, I don't know if they have them with COVID. I think they still do. They're kind of like big mail slots. That's what they look like. I know the Palm Beach County Sheriff's substation that's on Jog Road in Les Chalets. They have one there, but I would ask or pop into the local substation around here and see if they have it. I'm pretty sure they will, or you could call the sheriff's office and ask. They have an updated list of where the locations are, but there should be one around here somewhere.
How do we dispose of them? Do we dump them out of the bottle, or put the whole bottle in there with our identification on, or just what?
So you're talking about just in general. So yeah, you should, if you're gonna take them to the substation, I would take off your personal information from the bottles. They don't really ask any questions. You just dump them in the thing and leave. So I would take off the outside label as best I could, so that way they don't know, if someone were to get in there. I mean, they don't really look through it as far as I know. They just, send it somewhere and they incinerate it. But I would take your information off, and you can leave them in the original bottles and then just, put them in the container.
Thank you.
A regular and a stronger. I had to return the stronger one because I have sinus problem. Yeah, and I was told that if you're over 65, you should stay with the regular or not.
So I'm sorry, but I only heard like half of that. So
Yeah.
it just broke up. So if you want to repeat it, you could try to repeat it.
Okay, so
I think something's wrong with your audio. You might want to type it in the chat box because where you're fading out on us.
While she's doing that, I have another question. Well, can you take ibuprofen and Tylenol together? Or, I mean, I've always taken everything separate, but I was told that to strengthen it, you can put them together.
So the answer to your question is yes, you can take them together. They're different medications and they work differently. So that is a very common misconception. But yes, you can take Tylenol and Motrin or Advil together. Yes.
Wow. Well, explain how they work together, please.
Well, their mechanism of actions are totally different. So Tylenol, they just work differently. So Tylenol actually only has anti-fever and anti-pain properties. It doesn't really do anything for inflammation. Ibuprofen has anti-fever, anti-pain, and anti-inflammatory properties. So when you use the two together, you're kind of getting like a double effect. So it's safe to do that because, like I said, they work differently. And they have an additive effect. So yeah, we do it all the time.
Okay, thank you.
And I don't see anything in the chat box, Doctor, but we can even later on, if we get the question, I'm not sure who is asking it. We could always email it to you or call you with that.
Yeah, that's no problem. It's not a problem at all.
Okay.
All right. Well, I guess there's no more questions. Thank you for having me today. It was nice talking with all of you, and make sure you all stay safe.
Thank you so much for being
you.
here. And everyone, we're going to put this on our YouTube page. We'll have for just like a playlist. So if you ever have to refer back or have any questions, you can do that.
Thank you very much.
All
Hi,
right.
I had a quick question. Can you hear me?
Yes, I can hear you. No, I can hear you.
Okay, just curious, did all of you at the hospital get the vaccination? I have heard no publicity about it.
Did we get you're talking about COVID-19?
COVID, yes.
So it's not mandatory for everybody here to get it. We did get some from the state. And we have vaccinated some of our employees, but we're waiting for more to do more of our employees.
Really? Would have expected that everyone would have had the opportunity who wanted it to get it at the hospital, working there.
Like I said, whatever the state allocates us, they have whatever their allocations are, so we have no control over that. So
That,
Thank you. That's sad.
just so you know, that whatever we did receive, we did use. It's just that, you know, we're kind of waiting for more.
All right, everyone. Thank you so much for joining us. I really appreciate it, Doctor, your time.
All right, you're welcome. And again,
Thank you.
Stay safe.
Thanks.
Have a nice afternoon.
You too.